Welcome back, everyone. It is season 2 of the Skinsider podcast. We did not get canceled during season 1.
Nope, we're still holding on strong.
Unlike Morgan Wallen in Tampa.
Yeah, very big disappointment over the weekend.
We drove up there for that. We are not happy about that still.
No, but we did find a really nice restaurant.
Amazing
that we need to recommend to everybody. Yes, up in Lakewood Ranch.
Sneaks Clam Bar it was in Bradenton, but there's one in Sarasota as well.
I thought it was Lakewood Ranch.
No, I thought we were in Bradenton. Well, there's one in Sarasota and there's one in Bradenton, and either way, it was amazing.
Yeah, it was really good.
It was so good. It's known for like seafood and pasta, homemade pasta, and the drinks were good. The service was good. It was amazing. So we turned it into something
positive.
Beneficial.
Yeah, we had fun.
Yeah. Speaking of drinks, we're also back with our Skinsider margaritas.
Cheers.
And
cheers.
We're back with a guest. We have a lot of guests coming up this season. That seemed to be a big hit. You guys have a lot of questions. You asked us about specific questions, so we're going to try and answer them all for you guys.
I didn't take a sip.
Neither did I, so now I got to take a sip and then I'll continue.
It's pretty good. We had a new guy making our drinks today.
Yeah, I've never seen him before, but it is good. Do you like it?
Yeah.
Okay.
It's not too spicy?
She hesitated.
It's a little spicy.
we did no tahini.
Yeah.
We accommodate our guests.
We didn't say super spicy.
Yeah. And speaking of our guest, this is Dr. Joanna Moorfield from Mission Hills Dentistry. We wanted to bring you guys an episode about the rise in Invisalign versus braces. It's something we're seeing a ton of. I mean, my face is like in other people's faces when I'm working all day long, and all I see is Invisalign now in people's mouths. So we wanted to get down to the bottom of why. Why is it beneficial? Why is everyone pivoting over to this? So like you guys know, we always source out the best expert that we can find in each individual field. So I'm going to read you guys her list of accomplishments because it's lengthy. It is lengthy.
Thank you.
Also, shout out to my mom who's calling. Before we started this podcast, we discussed about how like my mom will start a text message thread like as soon as the podcast is starting, or she'll call. She just called. Hi, Mom. We're busy. Okay, so
Dr. future, block yourself off on Wednesdays, Mom.
Yeah. We're busy. Okay, so back to her accomplishments. She is a platinum Invisalign provider, which means like how many she has done, correct?
Correct.
Yeah. So she's platinum. Is that as high as you can get?
You can go higher, but for a general dentist, that's pretty much the highest.
Yeah.
Nice.
Yeah.
She also won the Top General Dentist Award. She is a Naples Illustrated top dentist and a fellow of the Academy of General Dentistry. So I don't think we could get you guys anybody more qualified to ask these questions.
Yes.
Love it. Well, thank you both for having me.
Well, thanks for coming and taking your time.
Happy to be
Yeah.
here. Yes.
Thank you. We do have a buzzword. Our buzzword is align.
Align, but not Invisalign.
Correct.
Definitely not Invisalign.
Yes.
No, we need to drive home. Yeah, but we'll do Align.
Yes.
Perfect. So I'll start with the first question here, Joanna. We want to know who's a candidate for Invisalign.
Okay, so it depends who you go to, first of all, right? So you want to make sure that your general dentist or orthodontist is comfortable doing Invisalign. And if they are comfortable with doing Invisalign, then really a lot of people could be candidates. Of course, there's specific cases that get really, really hard when you get really clinical. So there's something called an underbite and an overbite. Typically an underbite, so sort of when your lower jaw is over your upper.
As I'm trying to clench.
That's called an under.
Like the dogs.
Yeah.
Like a dog.
Yeah.
Exactly. I didn't want to say that. But
okay.
then sometimes those cases do get a lot harder. Not only because, Invisalign can't fix them, but then we're talking surgery. We're talking other things that may not necessarily be doable from a general dentist or an Invisalign perspective. Okay. However, do I do cases of that underbite? Absolutely. Because we can leave the patient in an underbite that's number one, acceptable clinically and stable, right? So we have these bites where they're not stable at all, but we can make these bites stable, just not, fix them from that, get them to that perfect sort of bite.
Right,
totally okay.
What does that mean, stable?
Stable means you're not breaking any teeth, you have no crowding, meaning you're able to keep everything clean. So it's more beneficial for you long term to have this stable bite, even if it's not quote unquote perfect, having those upper teeth kind of go over those lower teeth. But, we can leave patients in that underbite, no problem, as long as it's stable and clinically acceptable in a place where the patient's just going to benefit from having that bite.
Gotcha. So and aesthetically, it might not be what you want, but clinically, it's safe and
yes. And the patient, knows that in order to have that perfect bite, they have to undergo surgery. Are 30-year-olds, 40-year-olds going to want to undergo that surgery? Probably not, but it's always an option.
Yeah, I know someone that actually had like an underbite like that, and they ended up having to get their mouth wired shut.
That's what
for like months
to do.
Yeah.
So they essentially they break your jaw.
Correct.
Right.
Yeah.
So they have to break your jaw to bring it back, and then they have to fixate it. So they have to kind of hold it in place while you heal. Yeah. So it's
so you got to live off of smoothies.
Yeah.
Yes.
I don't even know what else you could suck through a straw than a smoothie.
Yes.
Yeah, you have to suck through a straw, right?
People get real
Really?
creative. Oh yeah, they'll do all sorts of concoctions.
I don't know if I could do that with my food and like puree it to where it was like mush.
I won't even drink smoothies. That's like a weird
See, I
fact
love
about
smoothies.
me. No, I'm like that consistency of like food being pureed and then drank. I can't.
But it's fruit.
Yeah.
No.
And yogurt.
It's like juice.
Yeah. Then you won't survive in another country because they got nothing but fresh juices over there. When
I
like
would survive in another. Wait, I can do the fresh juices. I can't do smoothies because like the juice of something is fine, but like pureed and then it's like chunky. Like no. I know. I'm gonna.
Luckily, she does not have a class 3 occlusion.
yes. Luckily, we're not wiring her jaw shut.
I'm not gonna do that. All right, I'm gonna ask our producer. Would you drink a fruit smoothie?
I don't eat fruit.
Exactly, and I just wanted her to back me up.
That's more valid than what yours is.
Yeah, well, I just had to ask. So then, okay, I know everyone's going to want to know, what is the difference between Invisalign and braces? Why might someone choose one or the other?
Okay, so with Invisalign, you can take them off, right? So teenagers could take them off. So compliance is a huge thing.
Yeah.
With braces, you kind of don't have another choice, right? They're in there, you can't take them off. It's going to work. So with braces, though, treatment tends to be a lot longer. You get into the orthodontist office every so often, and then typically a treatment could range between 1 year to 2 years. It's a much slower process. So with Invisalign, the great thing about it and why I'm so passionate about it is because you take them off, you brush your teeth as you normally would, you pop them back in, and if you're compliant and everything turns out great, I mean, we usually finish cases between 6 months to 1 year. So much shorter time frame than it is braces.
That's really interesting.
That's the opposite of what I would have conceptualized.
Yes.
Yeah.
Oh, that's really interesting.
Because I would feel like that cable or like wire would
See, when we were young, that was the only option.
I had braces.
I had braces,
but I had clear ones.
We had an option.
I did for the clear.
I had the ones that like pick the color.
Ceramic.
Yeah. So the ceramic ones were great. However, are great, but they stain very easily. So although they're clear,
you didn't want to eat.
They do get stained very easily. Yeah, but our I guess kids and like the younger generation slowly will not know what braces are.
Right? Exactly.
Invisalign is kind of the go-to now. I always say braces are like the flip phone, and Invisalign is kind of the iPhone. But really, again, there's some cases where I send over to the orthodontist for braces because I'm scared of a compliance issue, or the case is just better off with braces, traditional braces. But in general, I love Invisalign just because of that. Whenever I have teenagers, I see them their first visit after the braces are off, the amount of cavities that are there is just tremendous because it harbors all the bacteria. So number one, you can't really floss
in between
traditionally, them. Right? You have to floss using a floss threader or other techniques. But if it's hard to keep clean in general, now the teenagers are having to take that extra step to like flossing a certain way that takes longer. They're just not doing it. So the amount of cavities we see after braces is just way too much. So with Invisalign, we don't see that.
So I have a quick question though with that. So for instance, I have a retainer, like permanent retainer in. I want to get it taken out because one, I don't want the metal in my body. Now, what if I did an Invisalign for like nighttime or just like put it in nighttime while I still have that consistency of keeping my bottom teeth close to one another?
Correct. So after Invisalign, which we can talk about when I go through the process, but retainers are key. So permanent retainers also will harbor a lot of bacteria.
Very because you have to floss them different, just like the braces.
And not even if you're flossing daily as you should, or using a water pick or whatever, mechanism you want to use, it's still going to just accumulate bacteria so much easier.
Yeah.
So after Invisalign, some patients do choose to do a permanent retainer, but there's also a clear retainer that's going to look just like Invisalign that you use at night.
I want that.
But that's the key every single night, because with that, you don't have to think about it. It's already, retaining your teeth. If you don't have that, and then now you're wanting for them to stick and not go anywhere, you have to be really religious about wearing your retainer every night.
And then in terms of compliance, is there one, specific age group you see that's better than the others? Do teenagers take longer or adults take longer?
To be honest, adults are way worse.
Wow.
I can see that. Yes. I was actually expecting her to say that.
Go teenagers.
Well, because with teenagers, they're all wearing them. With adults, they're...
My little cousin's son has them.
And teenagers are with their parents' money, right? So they're kind of nervous. They have this responsibility to, my parents are paying for this, I have to wear them, etc. With adults, they're kind of whatever. If it works, it works. One thing that's bad about it, though, is that when it doesn't work, because you're not wearing it, then they blame it on the product.
Yeah.
Right? Invisalign's not working. And I'm like, but are you wearing them 22 hours a day? So yes, my adults are definitely worse than the teens. When I first started treating teens, that was my hesitation. I'm like, it's not going to work well because they're not going to wear them. Braces may be better off, but I have been proven wrong plenty of times.
Wow. Interesting. Yeah.
And then also we are seeing a rise of these at-home treatments, Smile Direct Club, things like that. What, other than the obvious benefit of having the eyes on you, what are the kind of differences between the two of them? What are the benefits with Invisalign?
So yes, so kind of your do-it-yourself, or the home kits that you get. No doctor is overseeing that, right? So are they tracking the way that it should? Is this company seeing the bigger picture, the crowns that are there, bridge work? There's so many restrictions that we have utilizing Invisalign. If the patient has an implant, if the patient has a bridge, we can't move those teeth. Right. And I think, I'm not sure how these companies work, but I believe they have to get an x-ray. I don't even know if they have to get an x-ray at their doctors, but I think with some of them, they have to get an x-ray at their doctors and then send it over. But that communication is just not there. There's a lot of companies too where it's you get 10 aligners and whatever your end result is, here you go. Or, you only have an extra 5 aligners. I said aligners, not a line. Oh.
It's okay. We catch ourselves.
Cheers.
Yeah, cheers.
So there's just not that control.
I miss this margarita. It's probably good.
There's not that much of control over what's going on, and I've seen cases where it's just gone so south.
Well, I did do a little bit of research on. We were prepping for this podcast, and I saw that one of them actually sends you a mold, and you bite into it and mail it out.
That's usually how they are.
But what if no one's monitoring? So first of all, you're biting it down
for impressions. So an impression is actually something really hard to do, and sometimes
I hate impressions.
We never
disgusting.
Everything that we do is digital now. So the fact that we're still having to do impressions for this is just crazy. But because obviously no one has a digital scanner at their house, they have to send over an impression.
Yeah.
So even for us to take impressions, there's so much room for error. There's so much distortion that can happen on an impression that's being done by a healthcare professional. So imagine having average Joe take their own impression. That has so much room for error. So starting off
it
that
could be
alone, it's disastrous. So yes, we do not recommend you do it yourself aligners.
You don't box order them.
No.
Go to a real dentist.
Honestly, they are cheaper, right?
Well, sure.
But for a reason. And I can count more than probably 15 patients that have done it, paid the money, come to me, and paid more money.
And then it's more expensive
because people want to take the cheaper route.
Time.
Exactly.
Correct.
I would say you get what you pay for.
Not to mention, I think Smile Direct, don't quote me, I think they went under. So, yeah.
am not sure either, but when I was trying to find research on them specifically, there was like nothing in like 2024.
Yeah. I know it because as an Invisalign provider, we got a lot of emails from patients like, hey, what do? I got left right in the middle of this whole treatment, and what happens now? Mm-hmm.
Well, you book an appointment, consultation, and we fit you for a new Invisalign.
Yeah, I guess I have to start over from the beginning.
They do, unfortunately.
Yeah. So you just kind of pay more than what you were really expecting.
Exactly.
Right.
In the long run. But you always need to do it reputable, I feel, and go to someone that's educated.
Yeah.
And that is what they do.
Right?
Yeah.
As with everything.
Absolutely.
Yeah.
Very, very true.
So, and then we kind of talked about the process of the treatment.
Yes.
We touched a little bit on it, but is there anything else you would like to elaborate on the treatment itself?
Absolutely. So it's really, really easy. So you come in, we take what's called the panoramic x-ray. So we want to see if there's any implants, any bridges, because again, there are limitations that we work around. Any previous dental work, crowns, make sure that there's not infection present. If there is an infection present, moving a tooth like Invisalign or any other treatment could actually stimulate that infection to get worse.
Yeah.
So again, we just want to make sure there's no big issues going on that we would have to address.
Yeah.
So then we take a digital scan of your teeth. So it's a 3-dimensional image that actually makes a before and after.
Is it like a little camera that kind of just like
camera? Yes.
Goes
no radiation involved.
I love it.
So it's just a little camera, and then it's beautiful because you see your teeth. Now we can actually put your face on it too, which is really cool. Before and after. Yeah, it's really nice. So then, we talk about the benefits of Invisalign and everything that, that you're benefiting from it, your teeth. And then I submit that over to Invisalign. I come up with a nice prescription for you. The next visit you come in, and then we deliver the aligners and we show you how to use them. So pretty much you use these aligners all day, every day. 22 hours a day is ideal. You're only taking them off to eat and to brush your teeth. That's it.
Okay.
So you keep these guys in all day, every day, change them out every 7 days. So
to a new set.
Yes. So you don't have to come see me every 7 days. I actually make my patients have the easiest time. Actually being more lenient and not kind of, babying them. Like, are you wearing them? Are you wearing them? It's actually better. Like I give them the responsibility. Here are 10 aligners, switch them out every, Wednesday at nighttime. And I'll see you back in 10 weeks.
Wow.
Yeah, so super easy.
Low maintenance.
Yeah.
Super low maintenance. And then once you get the hang of using them, I have some patients that are like, I'm going to miss them. Like, I'm so used to having these in that it becomes super easy. So then again, typically I finish cases 6 months, sometimes even less, sometimes more. Again, patient compliance is big and the severity of the case, right? So have I had cases last more than a year? Absolutely. Have I had cases 4 months? Absolutely. So then we kind of wait however long, say 10 weeks, 12 weeks, 14 weeks, whatever the case may be. And then we check, are you ready for retainers or are you ready for what's called a refinement? And I typically do refinements on most of my patients. And what that is just tweaking. There's some teeth that aren't going to move predictably. There's some teeth that are stubborn. There's certain areas that the bite may be off. So that's when the tweaking process comes, and that's what a refinement is.
Wow. Okay.
Yeah. And then if you have a refinement, we give you more aligners, or if you have retainers, then we go over retainer wear.
Nice. Now, how do they hold up in there? Like, how do you?
Yes. So there's two
things on the.
Yeah. So there's attachments, which are those little
They're like pegs.
Yes.
those little thingies.
So they're called attachments.
Okay, those attachments.
So for those attachments, also known as buttons, even though I don't like to call them buttons.
Okay.
So they're attachments, and they're made out of your filling material. So kind of the same exact thing that you get a filling on. We place that attachment, and what that attachment does, number one, yes, it helps keep the aligners in. But if you didn't have any attachments, your aligners would still pop in.
Okay.
Totally normal. So your teeth are actually kind of bulbous. So once it goes over that little hump, click, they click in place.
Okay.
So
do you not need attachments?
So you need attachments for two reasons. Number one, it makes your treatment a lot shorter. Why? Because they help move the tooth. Okay. So the attachment is, you can think about it as a pressure point. That aligner could push that attachment in a certain way, whatever that movement needs to be done. And it helps move the tooth more efficiently, more quickly, and you'll be in aligners less time. So I have some patients that are like, I don't want any attachments. Great, your treatment might be a little bit longer. Yeah. But movement is still doable without attachments, but the movement is better and quicker when the attachments are present, and they help with retention too.
Yeah. Wow. Yeah. That's interesting. I'm gonna need this after this episode.
I knew it.
You know it, oh yeah.
When I was like prepping for this podcast, I'm like, Ashley, it's probably gonna take her like 5 questions to be sold, and I don't even know how many we've done, but after this I'm gonna count. I'm like, she's gonna want this. I could just
It's great.
I could just tell. I could tell.
Yeah, because I want to get rid of this retainer in the bottom, like the permanent.
Yeah.
I don't want it.
That's an easy removal.
Yeah.
We just remove it and
I don't want it. I'd rather have these little trays.
And attachments.
Yeah. Exactly.
Buttons,
you see how far like braces have come, like or like aligning your teeth.
Right.
And then another benefit too would be your general dentist can do it. So now you're not seeing 2 different providers. Someone who's known your mouth, knows your mouth.
Correct.
Will continue to work on your mouth, now has eyes on it all the time. Because when you go to an orthodontist, that's more situational, and then you switch back.
Yes.
Like, I don't think I've seen the guy that did my braces since I was 12.
Yes. So, love my orthodontist out there, but it is I don't want to say a dying specialty because I still refer to them. So in some cases, even if the patient wants to do Invisalign and I feel like it's out of my hands, I refer. Orthodontists aren't really too fond of Invisalign. They were trained to do traditional braces, which I don't, it's what they know. As a general dentist, I feel like if you're involved, like I am with Invisalign, like we take a lot of continuing education for it. There are some orthodontists that do a ton. There's some orthodontists that do none, really.
Right.
But again, orthodontists are great. Like patients that are not very nice, here you go. Right? Yeah. So not just hard clinical cases, but patients that are just, we just don't want to deal with in general. But yes, so we love to be able to keep everything in-house, right? Like whenever you go to the doctor and they're like, oh, we're sending you to this specialist for your heart or your lungs or whatever the case may be, or for the ENT, and you're like, oh, but can you just see me here? Like I'm already here, right?
Yeah. So you feel like you're starting all over and explaining your whole process and journey
absolutely
all over again.
Yes.
Yeah.
So it's nice to be able to see the full picture for that patient and be able to not only do their fillings, but also, I'll say it, align their teeth.
Cheers to that. Well, I do have something to say based off of that, though. And after I take a sip of my drink.
It's your podcast. what would you like to ask?
It's ours. I would think that a lot of people now, it's because it's aesthetically pleasing to choose an Invisalign over the braces. They don't want to have people like looking with the braces and have that look of the brace. This hides it a little better.
Yeah.
So I think also because image is a huge thing today in today's world, that it plays a role. And I think that's a really good selling point for it. And who wouldn't want to go that route versus having brace face?
For adults and for teens. Like right now I have my niece that she's like, oh, I'm going to look so cool with Invisalign. Right? Like while all my friends have braces, like here I am with Invisalign.
Right.
Yeah.
So even for teens, I think they prefer the Invisalign route.
Yeah. Absolutely.
Yeah.
And then
just self-conscious, like they're dealing with that at that age.
Yeah.
So I get that. Oh, question. Does insurance ever cover it?
Yes. So if the patient has what's called an ortho coverage plan, so an orthodontic coverage plan, same as it would cover in an orthodontist office, it covers Invisalign at our office. Yeah.
So is that something people can add on, like when they have a teenager? Because
so once you have a dental insurance plan, there are options to add that orthodontic coverage. So once you add the orthodontic coverage, that's when usually a big chunk of it. So the way that insurance works with Invisalign and really with a lot of the dental things is, say you come in with no insurance to my office. Fee is, I'll throw a random number, which I think it's the highest, is $6,300, right, with no insurance. Now you have insurance, and your price automatically decreases to whatever sort of arrangement we have with that insurance. So say it's, I don't know, skin deep insurance. Pretend it's a dental insurance, and the negotiated fee we have is $4,800. Then that's how much we charge you for it.
Gotcha.
Whether you have coverage or not. Mm-hmm. So even having dental insurance decreases your fee a lot.
I feel like every parent right now is like,
do we have coverage?
Writing this down, like jotting it down.
Well, do you have another question on yours? I have one.
Yeah, go for it.
Overall health benefits for your teeth that aren't just cosmetic.
Ooh, that's a good one.
Love this. Yeah. So, again, I've already made clear I'm very passionate about Invisalign, but one of the biggest reasons I am is because I'm a huge advocate of the best kind of dentistry is the least kind of dentistry.
Okay.
Right? If we can avoid fillings, if we can avoid fractured teeth, periodontal disease, which is huge, that's the way to go. Right?
Yeah.
So, how do we get there? Having teeth in the correct spot is one of the number one things that we can do preventively to make sure our teeth last a lifetime. So why is that? So whenever there's crowding, yes, it looks ugly,
Right.
It's not aesthetically pleasing, but crowding also causes bacteria to accumulate there. So you just brushing your teeth and flossing, you're really not reaching those places because they're whether deep into the gum tissue or just harbored in areas that just aren't reachable.
Yeah.
When teeth are nice and straight.
I thought for sure I was already reaching for my drink because I was like, she's gonna say it. I'll just say it for you.
Yes.
Align.
Thank you.
Cheers.
Because I committed. I was fully committed.
You were
to
ready.
that.
So once teeth are straight, just water, your own saliva is constantly flushing away that bacteria that otherwise, if it was crowded, would just kind of harbor and stay there, bad breath, all sorts of things. So teeth that are straight, and again, the gum tissue is healthy. Number one, you're not going to have periodontal disease, which is gum disease, which you can lose your teeth that way. And then your bite in general is better balanced. So teeth break whenever one side hits harder than the other. So having that alignment on your bite will also, prevent you from getting crowns in the future, TMJ issues, or a joint that is connected right here. Whenever that bite is not where it should be, we start to get joint pain, headaches, etc. So all of those things are very, very important. And I think patients don't realize how it's not just aesthetically, right?
Right.
Yes, we all love a beautiful smile, but it goes way beyond that.
Absolutely. I always say, like, for me, first impressions, I always look at shoes and feet. I mean, teeth. I'm sorry, teeth and shoes on somebody, because that really can tell their hygiene. I honestly have always said that teeth and shoes are something that I always look at people.
Then what about like Golden Goose sneakers that are like made?
I hate those sneakers.
Right?
What?
Super dirty.
Yeah, I like clean sneakers.
I mean, I don't like the.
I don't knock on anybody.
They make the clean
Listen, because you're walking around in a $500 pair of sneakers. I don't care. That's okay, but they're dirty.
I know. People don't get it.
By the way, I know
it's stupid.
It's stupid. I like Golden Goose. I just don't like the ones that are like super dirty. I don't mind them looking like a little scuffed up because that's the appeal of it.
But it's a custom dirty.
But it's a man-made.
It is
dirty.
Yeah.
But I do have to say the new ones that are like super clean are
nice.
really
they have new ones that are clean. See,
that
now
are
I would
bright
invest
white
in
and
those.
beautiful.
But I like clean. I'm a clean sneaker girl.
But then if you get
Except
them
for
dirty,
today.
it's like, okay, now they're just
they look
authentic
just
Golden Goose.
Yeah.
Like then you don't have to be as mad that they got your $600
Okay, well,
sneakers.
it's a designer shoe, so I would notice that, but I'd say you have good style, even if you had that shoe on. But I just look at shoes because I feel like that style, hygiene, and same with teeth. I don't know why. It's just something I've always...
Teeth is a big, yeah.
Well, there's actually a meme out there I saw the other day. It's like this guy posing on a picture, and he doesn't have a tooth.
Eyebrow.
Yeah, he doesn't have a tooth. And then it's like, oh, I bet you didn't notice that he also didn't have an eyebrow. So you're like, oh, I didn't even see that because your face.
Yeah, you were looking at something.
The tooth.
Yep. Yeah, that makes sense. So I don't know, because I feel like people take care of their teeth.
But you'd be surprised. I mean, I see a lot of patients where head to toe, like immaculate, and then they have like all this crowding. And then that's what I think, right? I'm just like, you can tell you're someone that not only takes care of themselves, like how you look, but also like you're super fit. Like you can tell that, again, you just care about your well-being. And
then their mouth
is just not a priority.
Wow.
Yeah.
Yeah.
I wonder if it's because of the fear of the dentist. Like, so many people have a fear of the dentist.
I don't have a fear of the dentist. I was a dental assistant in high school.
Oh,
I was on a co-op, so I got to get out. Oh, I loved my hygienist job. My assistant, like, I got to see extractions. I was there, like, doing it all next to the doctor, the dentist. Yeah. I loved it.
I'm actually a germaphobe.
And you know how I feel about it. I'm a
germaphobe, too.
I don't like mouths. I take good care of mine because I don't want there to ever be an issue. Like, the less hands in my mouth, the better.
So she
no one really wants hands.
apron in my office. Lead aprons are those that we put to protect, the body from radiation.
Yeah.
And she actually makes us put it on her because she's nervous, kind of like
it's like a weighted blanket. Yes, like a weighted
and
for anxiety.
Like HGTV, and I just pray until it's done.
It's her spa day.
Yeah. Wow.
And I will say, she has the best hygienist there, Lindsay. Shout out to Lindsay, because there have been now 2 people like that I said there who didn't even, like, I forgot to even tell them to, like, ask for Lindsay, and they were like, oh, I gotta tell you the hygienist. And I'm like, was it Lindsay? And they're like, Lindsay, yes, that is who it is. And I'm like, I know, she just makes you, like, very calm. And she has this, like, bedazzled looking, like, tool.
That's cute.
Bedazzled tool.
Have you seen it?
I
don't know what a Cavitron
is. It the one that, like, zzz under your teeth?
I don't know. Oh. We have to ask her. But I saw it once, and she told me
she's not the bejeweled kind of person.
I know she's not, but she's got this one tool that she got when she was in, like, dental school. I think she told me about it once.
I love it.
I have seen
That's so cute.
Yeah.
Aw.
And it's
no, but she is great.
Bedazzled. She is very good. So you said that it caps out at $6,300?
Prices, yes. It typically depends on what office you go to, but about $6,300 I think would be the max that you'd be paying for it.
The whole treatment.
Okay.
And then what's average?
And then average, I would say like $4,800. If you have insurance, it can drop to $3,900.
Okay.
Do you let people like do payment plans, or like half in the beginning, half at the end, or is it all up front?
It's typically all up front,
Okay.
But we do accept something like care credit,
Okay.
which is great because then, we take care of your interest and then you pay it as you go.
Right.
I think up to like 24 months.
Okay.
Which is pretty nice.
And then an interesting thing that I heard you say as you were explaining to us the health benefits in everything with the teeth, that you said a lot of people with TMJ. Now, at your office for cosmetic, do you guys do Botox for TMJ? So I know a lot of dentists are getting into the Botox side of things.
Yes, we do Botox for, it's called the masseter muscle, so the muscle right here. And then, yes, it prevents our patients essentially from clenching. So when they don't clench, their TMJ, depending on what they have, it will usually relieve it. So not only for the TMJ, but for the teeth themselves. Because when you're clenching, that's not good for your teeth. You're wearing them away. You're adding extra pressures that you don't want. So it works really, really nice. Okay. You all do it.
Yeah.
That's going to be...
We have a couple of clients, that do come in and get that done and request to have that done. But I don't think a lot of people know that you can do Botox for the TMJ area and the masseter muscles.
Masseter.
Masseter.
I agree.
Which is pretty much
people don't.
And then it also makes you look a little slimmer too. Because, if you have a very active muscle, then it can protrude. So if it's nice and
kind of
calm and relaxed,
tightens it a little bit.
I think I don't know.
If you clench your teeth,
I don't
know. Then you have to be a clencher.
I'm
not. That's when
even when I'm at the dentist and they're like, bite down, and then I do, and they're like, no, bite down. I'm like, I am.
Yeah. That's me.
Actually, I'm biting down.
Yeah.
Because I don't know.
I'm trying to bite right now. I'm
biting down.
Yeah.
Like, does that feel clenched?
I'm like, is one side higher than the other?
Clench again. I can feel it.
Yeah.
It's not very strong, but it's there.
Yeah.
You have it.
I have a weak masseter.
You got a weak muscle over there.
Masseter.
Yes.
No Botox for you.
That's another thing about Invisalign. When your bite is not where it should, right? I can't stop you from clenching unless we do Botox, but I can't stop you from clenching. So when that bite is not coming together as it should, that's when we start to see the harm. That's when we start to see kind of things go south. But if we can at least control the bite and make sure that it's mutually protecting each other, you clenching shouldn't do as much harm on those teeth.
Now, if you have a couple of veneers, can you still get an Invisalign?
Yeah, absolutely. The only thing that we have to be careful with when it comes to crowns or veneers is not adding any attachments. So those little bumps, those little
wouldn't go on those teeth.
It wouldn't go on those teeth. Yeah.
Makes perfect sense because it's really not your real tooth.
Yeah, I mean they can, but I personally choose not to.
Okay.
Yeah.
We
can still.
Yeah, because you have to pull it, so maybe you could like.
So they're very hard to bond to these. So I would have to do a specific kind of bonding where it can remove kind of the shine of it, or it's just I'd rather not.
Okay.
And we can get around it.
Yeah. Sounds good.
Again, remember attachments aren't 100% necessary. They're just
helpful. Yeah, and I get that. That's definitely. I would do the attachment.
And I guess if you have veneers, you don't need as much
movement or like
work,
it depends,
right?
So a lot of the times we actually want to do Invisalign before we do veneers because it's less aggressive. We remove a lot less tooth structure if your teeth are somewhat in the correct spot. But if your teeth were kind of in the correct spot, then yeah. Typically with veneers, you can kind of tweak and fix whatever you were going to fix with the Invisalign.
Right. Mm-hmm. That makes sense. Mm-hmm. And then we have a question for you that we ask every guest. What is your favorite skincare product and why?
Well, I do have a lot. Right now I'm not using a lot. Busy mom of two over here. But I do like the one I use at night, the DEJ...
The revision?
Yeah. The revision. Mm-hmm. Yeah, I like it because I think it has a little bit of the retinol. I think it has like 0.25. Mm-hmm. And it has the moisturizer too. So you just cut two steps in one.
Yes. It's my favorite products to have.
Yeah, I know. And
a combo product.
Yeah, I love it. It's just time.
Yeah, and a lot of people now are minimalist.
Also,
like they don't want to have all these things out.
Yeah.
And,
that's true. Yeah.
You know,
I have my little drawer, and then I have like, this is my morning ones. These are my night ones, and it's just like ready to go. Boom, boom.
Yeah.
So it's just easier.
And you don't peel from it.
Yes, and I am pretty sensitive from any kind of retinol, so it's nice to know that I'm getting that exfoliation every night.
Yeah.
But at the same time, not getting the irritation. And then again, two steps in one.
It's good for Florida too.
I like
not like
steps. Because also people find it hard to even like find the time to do all of the steps.
Right.
So when you can dumb it down,
let things dry in between.
Right. That's a lot, you know.
I actually think about you every single time I have my face drying. I'm like, she said I have to have it dry. Just wait 2 more seconds.
You should buy yourself a little handheld fan.
I know.
I just do things in between. Like
go get dressed.
Yes. Yeah. Like I'll get out of the shower. I've already washed my face. I usually wash my face in the shower.
Same.
And then I'll get out. I'll do my toner. And then I'll start doing like my chapstick and brushing out my hair. And then I'll do like my serum. And then... You know, I brush my teeth and then I do my eye cream. Like, I move through.
But I do wait, so you should be proud.
I'm very proud.
Yeah, absolutely. Very proud. At least you're using it.
Yeah.
Another thing we do every episode, and we're going to surprise you with one.
It's a Reddit question. Let's see what we have in our archives today.
Yeah, wet your whistle.
I just want you to know that both of my parents have texted me since I've been in here as well.
See? Like, it's like...
And it's like, you want to know what they are? My dad, cover for the lounge chairs will be delivered Thursday the 18th. My mom, this is Flamingo Appliance reminder of your service appointment.
At least they care.
Because I have to go to their house this weekend, and I have to, they're not here right now, so I'm like, I'll go there. I have Mondays off. Like, I'll do all your service appointments. I'll take care of it.
Yeah.
But, like, yeah, these are my messages that I get. So, love you, Mom, Dad.
That is so funny. Like, we do this every Wednesday.
But it's, I don't know if my family's going to be listening to this, but sometimes my parents, well, I'm talking about some other people in my family, but sometimes my parents will be like, well, why don't we just like go to the child that wants to hang out with us and like be with us? Sometimes they'll say that because sometimes I feel like you? Yeah, it's me.
Oh, I hope.
Like I'm the one that they always like. I always want to be with my parents and like, what are you guys doing? Like, let's hang out. Like, where are you at now? I call them every day that they're here, and I'm just
I hang out with my parents, especially when they're here. I see my mom all the time. Even though I know deep down, I think she wants to see my son more than me.
See you.
Because there'll be times she'll come over. Like, during the day when I'm not there, like, I'm at work.
Yeah.
And she'll come over and hang out with him and his nanny, and then I'll text her that night and be like, hey, do you want to come over from dinner, making dinner? And she'll be like, oh, no, I already saw Christian today. And I'm like...
When?
There's also me.
Yeah.
That you get to,
Okay.
Yeah. That's funny.
They love the grandbabies.
They do.
I get it. My parents are the same way with the grandbabies.
Yeah, my mom will apologize. She'll be like, are you sure your husband is okay with me going again? I'm like... Are you kidding me? Come help us. Like,
exactly. Absolutely. Yeah.
What's that saying? Like, the only, like, parental hack you need to know is, like, live near the grandparents.
Oh, my God. For sure.
Yeah. Well, my sister-in-law, sometimes she'll answer. She's like, are you calling for me or Natalia? I'm like, oh, I'm so sorry. I'm like, can we just get her a phone then, too?
Yes.
Because I feel bad. And she's like, I'm like, all right, I'll call you and talk to you. Let's talk now.
Yeah.
I love that they both texted you.
Yeah, both about things. Okay, so this Reddit is, am I the only one who finds the Tray Minder and Invisalign apps pointless? Am I using something? Or am I missing something? I'm sorry. What is a Tray Minder?
So those are probably apps. So that I'm familiar with my Invisalign app. And what that is, it's an app that our patients download to help them keep track of what aligner they're on and as a reminder of the progress.
Okay.
Yes. So there's a lot involved in it. So you can actually take pictures as you switch aligners, and your provider will check that picture to see if you're tracking.
Okay.
So it has really cool things that you can incorporate to just make sure that, number one, it's working, that your teeth are moving, and count
without having to come in.
Right. And it keeps the patients accountable, right?
Yeah.
Like, you know that not only did we write the dates on your aligners, you have an app that's, reminding you every single time that you have to switch to a new aligner, making sure that you have them in. So it helps. Now, is it 100% necessary? No. You can go by just fine without it, but it's just that another aid to help.
Which I think some people do. Sometimes your life can get a little crazy and hectic, and you need that reminder.
Exactly. And if you use it, you use it, and if you don't, you don't.
Yeah.
It's like having a calendar on your phone versus trying to remember.
And again, there's a lot of cool things in there, like having that one-on-one communication with your doctor without having to call them or show up. It's just the pictures get sent directly to our website.
Makes it easy. I think it makes it very easy.
We like easy.
Yeah, absolutely. Key.
Especially in today's world.
Yeah.
So busy.
And everybody wants instant gratifying results too. So I do feel like an Invisalign is a way better option to hit that faster than your original standard braces or traditional,
or flip phone, right?
Yeah, flip phone.
What's the cost analysis between the two?
Between
braces and Invisalign?
Same. So with the only difference that typically, as you see a specialist, prices are typically more expensive, right? Because it's a specialist. So, but for the most part, again, fees are usually dictated by your insurance. So whether you see the specialist or you see us, but if you are just no dental insurance, then braces, I would say comparable. Like if you go to an orthodontist, Invisalign might be a little bit more expensive than braces. But when you come to us, we only do Invisalign. So it'll be comparable to braces in seeing an orthodontist.
In braces, I forget because it's been so long. After how many weeks do you have to go in to get your bands changed out or get it tightened or you
have to go often, and also
so
knowing
it's kind of less convenient.
Oh, for sure.
Yeah,
and for longer.
Yeah, it wasn't 10 weeks.
Right, exactly. Think about
I know it wasn't 10
maybe
weeks.
every 2 weeks, every 3 weeks.
Yeah, I don't know exactly. It depends on the case.
But I know it wasn't.
So then you'd always have to go back and an appointment.
Get popped out, and then they're hitting you, and
yes,
that happened to my retainer here, and I decided to take it upon myself and bend it back.
Oh gosh,
till I get it fixed. It was just a little bit.
Maybe you should come to my office.
Sign me up.
Of that,
the next
how
appointment.
Can people get in touch with you if they want to follow up and ask you questions, or if they're interested in the procedure or looking for a general dentist
in town? Yeah,
absolutely. So my practice is Mission Hills Dentistry. Phone number is 239-776-7626. And my Instagram. So I'm usually pretty active on my Instagram. If you all want to send me any messages or reach out that way, you can see some before and afters. We don't just do Invisalign and cosmetic work, but we do root canals, crowns, extractions. Ooh. Yeah, not fun. But still, it's our everyday. So so my handle is at Dr. Joanna Moorfield. Pretty easy.
Perfect. We'll link everything too, and then any questions you send our way, like Instagram DMs or whatever, we can
shoot them over
pass along.
Yep, absolutely. Do you have any more questions?
No, I don't. I think we covered it all.
Do you have any questions for us?
I don't. Who's your dentist now?
I don't have one.
Mine's.
I did have one, but I will tell you, the last time I went, I was very turned off by this dentist's office because I felt like they just kept adding things, and I didn't need it.
Well, I'm actually glad you brought that up, because with Invisalign, we get that a lot.
Really?
It's always like, why are you talking to me about this? It's just another, trying to sell me stuff, which we get as dentists, and it kind of comes with the territory. But really, it's just the reason why we bring it up again is just not to try to sell anything. It's really because we believe in the product, and we believe how better off your teeth are going to be in the correct spot. Yeah. So, we do get that a lot. But it just comes with it, I guess. Yeah. But yes, some practices absolutely.
Yeah, they were pushing. And for me having the insurance and for how much money I was actually putting out of pocket, I was just like, it just makes no sense to me.
Stuff. Yeah.
it didn't make sense to me. I was spending more money than I was paying for insurance throughout the whole year.
Right.
For things that I really don't think I needed.
Yeah.
So then I was like, I was turned off by them.
Yeah.
But now when my next 6 months comes up, I'll be ready.
Yeah. Good.
But thank you so much for coming on and giving us all your knowledge about the Invisalign and everything. We really appreciated taking your time out.
Thank you both.
Yeah.
Happy to be here.
Yeah, thank you.
And we've got a great season coming up. We're so excited about it. We have awesome episodes, awesome guests this season. We have a lot of really cool topics we're going to be delving into.
We might do like a freebie episode too, like a little freestyle like we did it for our last one, which I thought was pretty funny. Yeah. I liked our last episode from season 1.
Yeah.
That was pretty funny.
It was.
I agree.
It was
I liked it.
Yeah, that was a good one.
Fun. So we'll do stuff like that again.
Or write in a topic.
Yeah.
You know, if anyone wants to get knowledge on something else, let us know and we definitely can try to put that together for you in a podcast.
Yep. And remember,
love your skin.